This is going to be a video about left-right judgment training, which can be used as part of a graded motor imagery program to drive cortical changes in patients with persistent low back pain. We'll discuss the theoretical underpinnings of left-right judgment training, modes of implementation, normative values, optimal training dosage, considerations for pain, and tracking results. Left-right judgment is a treatment designed to elicit changes in the brain. It asks patient to accurately categorize a model whose trunk is rotated or bent to the left or the right. This treatment more traditionally had patients with unilateral chronic limb pain discriminate between pictures of left and right limbs, but has been adapted for patients with persistent low back pain. The theory behind left-right judgment is based on the idea that to categorize an image as left or right, we need to make a mental movement of the body part in our mind, though there is some debate about the theoretical underpinnings for patients with low back pain. Left-right judgment and GMI as a whole is purported to work in two ways. First, it can help restore some of the precision to body representations that might be lost with persistent low back pain. In other words, it might unsmudge some of the areas of these brain representations. Second, it's a way to begin disassociating activation of movement areas and pain areas in the brain. Breaking this association can help us reintroduce to movement-based therapy more effectively later in the treatment course. There are a couple ways to implement left-right judgment training. The Neuro-Orthopedic Institute sells the Recognize app for Android or iOS devices or standard flashcard kits. It is also possible to make your own flashcards using magazine pictures or other photographs. Currently, I think the easiest way to implement this training is through the Recognize app, as it packs in many powerful features, including a huge database of images, speed and accuracy tracking, and automatic sharing between patient and clinician. For this video, we will focus mostly on this mode of implementation. According to a study in 2014 by Bowering et al., average reaction time for a left-right judgment task for the low back was approximately 1.7 seconds plus or minus half a second. Reaction time was unchanged between patients with persistent low back pain and healthy controls. Average accuracy was approximately 76% for patients with a history of back pain and current back pain, and approximately 84% for all other participants. Normal results should also demonstrate relative similarity between right and left sides. The Recognize app allows us to modify image type, number of images, and image duration. For image type, there are 4 types of images. Basic images show models with minimal adornment against a neutral background. Vanilla images are similar to basic images, but can now be rotated 90, 180, or 270 degrees. Context images show the model moving their trunk to the left or right, but in the context of a functional task. Finally, abstract images are representations of models demonstrated through art, sculpture, or edited images. Image duration allows you to set the duration of time an image is shown before advancing to the next image. Number of images allows you to adjust the number of images shown in a bout of training. The broad recommendations from the Neuro-Orthopedic Institute are to begin with the number of images set to 20, image duration set between 5 and 10 seconds, and image type to vanilla. Training dosage is variable in the literature, but typically ranges between 10 and 15 minutes per session with 1 to 3 sessions a day. In the absence of formal data to determine training load, we can look to the general principles of graded exposure for guidance. Aim to find a starting dosage that feels comfortable and doable for your patient. Keep in mind that even though we're not moving yet, left-right judgment training can be mentally tiring. From there, aim to do a little more each day, but not too much more. Over time, aim to increase both training volume and task complexity. You could also consider varying the context in which the patient practices, consistent with principles of variable practice for learning. For example, the patient might try practicing in different locations, in different moods, or even with different music playing in the background. In general, look for patients to achieve accuracy of about 90% with average response times below 2 seconds and relative accuracy between sides before progressing task complexity. In terms of total training duration, most studies have used a training period of about 2 to 3 weeks for left-right judgment training before progressing along the graded motor imagery ladder to imagined movements. Remember that the patient should experience no to very minimal pain with training, as we are aiming to disassociate pain and motor excitation in the brain. This is different from typical recommendations of exercise for patients with chronic pain. As far as I know, there's no formal evidence investigating optimal pain allowance during graded motor imagery training. However, this remains the recommendation from the Neuro-Orthopedic Institute based on the theoretical underpinnings of graded motor imagery. If the patient is experiencing pain with the task, we have a couple options. First, we might try decreasing image complexity or number of images per round, or increase rest in between rounds. We might try cueing the patient to try and make their decisions on left-right judgment really lightly, almost as if they were guessing. Ideally, in left-right judgment training, the patient shouldn't be consciously imagining themselves move. However, patients who are relatively new to this task sometimes have trouble with this. Over time, however, this does seem to become easier for patients. Recent research suggests that it may take between 40 and 80 trials for this to occur. Also, we might try using left-right judgment in conjunction with relaxation or mindfulness-based techniques. Or we could vary the context of the task, for example, playing the patient's favorite music in the background. We should always emphasize, as part of a pain neuroscience education approach, that it is very unlikely that any damage is occurring with this task. Emphasize messages of safety, despite any soreness that might have occurred. As the Neuro-Orthopedic Institute is fond of saying, sore but safe. Finally, we might try regressing from left-right judgment training to movement observation, during which the patient watches others move, either through video or through in-person observation. We won't discuss this technique in great detail, but you can check out the Graded Motor Imagery Handbook for more information. The Recognize app includes powerful result tracking features. By clicking on results in the main screen, patients can view their past test accuracy and reaction time results, as well as the trend lines over time. These results are also automatically shared with the patient's clinician. Results can also be filtered by the type of test or the date range in interest.